Hi, my name is Rosanna Carrillo. I'm a certified physician assistant, and I want to talk to you today about chronic pain, mostly chronic pain and opioid use. I also want to talk about in videos to come about hacking chronic pain uh, and without using opioids. I too suffer from chronic pain. I have for many years. I went through everything like I was taught to do, all the tests, everything that happened. And then I also went through all the medications to try to help the pain. The muscle relaxers, the gabapentin, the anti inflammatories, everything. And they all helped. They all helped for a while. I mean, I used to love ibuprofen, 800 milligrams a day, 3 times a day. I took that for years and it did work. Then one day it didn't. Plus, the side effects to it were not good. Um, Luckily, I didn't have any side effects till the end where I started just bruising all over the place. Now, I have a warning for you all. I'm not practicing. This is not a practice. I'm not encouraging you to do what I did, where you take the anti inflammatories like that. You have to talk to your own provider. I'm just here to help you with some guidance on maybe how you can, in addition to what your provider's doing, how you can help to control the chronic pain, to hack it in different ways without using opioids. Now, in my practice, opioids, by the time I got to patients got to me, they had been on opioids for a while. Trying to get somebody off the opioids is not easy. And really not everybody needs opioids every single day. In fact, most people don't. Yeah, not I'm not saying that you don't have pain because I know you do. And I want to stress that providers do believe you have pain. However, what happened is the federal government all of a sudden said, guess what? We have an opioid problem. And so we're going to come down on providers providing those opioids, and we're going to come down on people taking those opioids, or we're going to watch them very carefully. So then, uh, in addition to that, the worst thing was that all of a sudden they weren't available. Then what do? You're used to taking 3, 4 a day. Some people up to like 6 pills a day, and you're like, what the heck? All of a sudden, you can't get any and you feel sick. You're going through withdrawals. Well, we can give you something for the withdrawals, but it's not the same as having your pain medicine. And then what do? Well, we can't make the pain medicine. Yeah, we can try prescribing you something else that's another opioid, but guess what? Those aren't available either. And plus, it starts looking pretty suspicious to the federal government, to the DEA, that this one, well, they tried prescribing this and they're going to this pharmacy and that pharmacy. And then all these rules and regulations. You can't change pharmacies. You can only get one script a month. All kinds of different things happening. So what do? Well, it's up to you. It's up to you. Don't let them take your power, because what happens is after a while, when you've been taking that pill, you're like, oh my God, if I don't have that little bitty pill, I'm going to have such pain that I'm not going to be able to stand it. And you got to take your power back, people. You've got the power. I have faith in you. You've got the power to control your own pain. What you got to do is just make up your mind. I mean, if you really want to think of it, think of the future. Okay, I am going to cut down, because if I don't, and I don't have any when I go a little extra when I go get a new prescription and that prescription isn't available, I'm going to be in a heap of trouble. I got to start listening to my own body. I got to start taking my power back. I got to start trying to control it. Like I tell patients, um, I don't know, let's say you're prescribed one every 6 hours. That's, for a day. Okay, well, maybe instead of in that 6 hours, take a half. If you need the other half, then take the other half. Maybe you won't need the other half till almost the end of the 6 hours. Then you can start 6 hours from when you take the other half. Okay, go easy. Take other things like the anti inflammatories we were talking about. Of course, always run that by your provider. Take other things. And and the biggest part is the mind body connection. Really think if you really need that. Don't just do it because you've had a bad day and you're stressed out and your pain seems worse, because your pain is worse, because stress does tend to increase your pain. Just try to calm down, start breathing, meditation. YouTube, the school of YouTube is excellent for learning meditation and other techniques to stretch and move around so that you can control your pain. Also, that's another thing. You got to keep your body moving. A lot of patients tell me, well, oh no, Rosanna, well, I hurt. Well, yeah, well, guess what? You're going to hurt worse if you don't move. I mean, I don't mean to go out there and run 10 miles and start doing everything all at once. That's not right. I mean, think of it. Think if you had a car in the garage, it's been sitting in the garage for months and you haven't run it. Then you take it out to run, and guess what? It won't start. It won't start because you haven't been running it. So you have to give it a jump and you have to keep running it so it'll start running like it used to. Well, maybe your body won't start running like it used to. However, it will run better. You keep that circulation going. Our bodies were meant to move, not just kind of sit there. They're meant to move. No matter how little you can move, just go little by little. You'll be surprised. You will surprise yourself. And there are so many things, so many techniques to controlling chronic pain, so many techniques for getting off opioid pain medicine, or at least reducing it, that we can go into it, and we will go into it in further videos, because pain is complex. It is a mind body thing. It's, a lot of it is in your brain. I'm not saying it's all in your head, but controlling it is in your head, part mostly, not totally. Anyway, it's complex. We can go into it in further videos. We can go into your journey with chronic pain, my journey with chronic pain. We can talk about what's going on with you, your challenges, the things you're going through. I'm here to answer maybe beyond what your provider would tell you. Your provider will, do your labs, make sure you have your medicines or things that are going on, or tests and things like that. And I can tell you like other things you can do, or um, techniques you can use to start moving. Okay, it's going to take time. It's not going to happen overnight. The best thing is just to take one day at a time. I have faith in you. I know you can do it, just like my patients can do it. I'm here, you're here, and together we can go over this in future videos. Until next time, this is Rosanna. Bye.